This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
Hey everybody, my name is Chantal. I'm one of the PGY floors at Stanford and one of the chiefs. I'm joined by my colleague here.
I'm Matt. I'm one of the PGY3s. Really excited to chat with you. And then we have two more of our chiefs, Bonnie and Jerry, that'll be answering your questions in the chat. So feel free, if things come up, just throw them in the chat. They're happy to answer them.
Yeah, and feel free to throw them in the chat while we're presenting. Bonnie and Gerald will be at the ready to answer your questions. So let me share my screen. All right. Hopefully you can all see this. So welcome to Stanford. We're super excited to talk about our program. Matt and I love being here. We love our co-residents, and it is an honor. Thank you, PM&R Scholars, for inviting us to present here. So I think you've already been welcomed to California with all of the programs that have gone today already, but Stanford's located specifically in the Bay Area, so in Northern California. This is where we are, very close to San Francisco, San Jose, geographically proximate to a lot of places. If you like to surf, if you like to hike, if you like good food, if you like good weather, that's all in the Bay Area. So we're very happy to be here. With that in mind, where do we work within the Bay Area? So if you look at our home base, it's technically in Palo Alto. So Stanford Hospital is in Palo Alto, and the Palo Alto VA is in Palo Alto. So a little bit more north to that is our Redwood City Clinic. So that's where we do most of our outpatient sports and spine exposure with our Stanford attendings. And then if you go south a little bit more to Santa Clara Valley Medical Center, that's where most of our inpatient neuro rehab rotations are. So you can see that there is a little bit of a distance between our sites. And with that in mind, most of our residents end up living in the South Bay area. So I would say probably Mountain View, Sunnyvale, Santa Clara, San Jose. Matt lives in Campbell. Some residents live a little bit more north, but anywhere along this stretch is our most common commute. So we'll do a quick bird's eye view of all of the different hospitals that we rotate at. So starting with Stanford Hospital, it's a really, really nice facility, truly state of the art. We get super unique cases. We have patients coming from all around the world to get their medical care here. So it's really an honor to be able to serve and treat a very diverse patient population. This is what the lobby of Stanford Hospital looks like. And we spend a lot of time here when you're on the Stanford Consults rotation, as well as with different electives that we have that are attached to the main hospital here. In terms of the Stanford Redwood City Clinics, this is the site that's a little bit more north on our map of the Bay Area. And this is where we do the majority of our outpatient sports and spine exposures. So as early as PGY2 year, you're going to be doing sports and spine, and you're going to get hands-on with injections and procedures. And our attendings are really good at giving you autonomy to perform these injections very early on in your residency training. So we appreciate that very much. And we get a very wide referral network, and we do a lot of cutting-edge procedures here. Matt will talk about what some of the attendings do, but we have a lot of orthobiologic exposure. You're doing all of the spine procedures as a PGY2, epidural steroid injections, medial branch blocks, SI joint injections, etc. So you get a lot of exposure early on, and then you build on it throughout your residency here. Santa Clara Valley Medical Center, this is our primary inpatient rehab unit that's located in San Jose. This is a county hospital that is super, super well resourced, and we love being here. We treat patients from all different socioeconomic backgrounds. There's 2 floors for inpatient rehab here. So the 3rd floor is for our SCI patients. 4th floor is for our TBI, so stroke and TBI patients combined. And we spend a good majority of our residency training here just on the inpatient side. So this is a picture of Valley Medical Center, and it's a very nice county hospital, and it's a place where PM&R is very well known and well respected within the hospital system. So we can really make a big difference and a big impact on the patients that we see, even if it's a consult from the medicine side or from the surgical side as well. The Palo Alto VA, this is where Matt and I currently are because we play basketball at 6 p.m. every Wednesday at the VA. But this is one of the few veteran polytrauma acute rehabilitation centers in the country. So we are unique in that regard. We do inpatient and outpatient training at the VA. So I'll show you a picture of our new building that was just opened last year. It's super nice, and it allows us to serve, such a wide variety of veterans here. So this is what it looks like from the outside. This is Building 500, our new rehab facility. And specifically, if you look on the left side here, this is where our PM&R clinics are. So most of the outpatient MSK and injections, EMGs, that's where that will occur at the VA. And on the right side here, you have 3 different floors. So on the first floor, you have the inpatient polytrauma unit, where you're basically helping the vets who've sustained polytraumas and helping them in the acute recovery process. The second floor is our blind rehab unit floor, which is a unique exposure to what blind rehab is in general. And it's primarily an outpatient unit where the patients, sleep overnight just to get their care. But you can get exposure to what blind rehab looks like. And then on the third floor is our polytrauma transitional rehab program, which is basically helping our polytrauma patients transition back into the community after, sustaining some sort of injury. So what does a sample schedule for PGY 2, 3, and 4 look like? So we'll start with the PGY 2s. I think it's a really good breakdown between inpatient and outpatient in general. So this is a sample schedule where we start on Stanford Sports and Spine. And again, that's where you get a lot of your procedural exposure with ultrasound, with spine procedures, bunch of injection numbers. Also, you're getting your EMG numbers on that rotation too. So you start very early, and this is just something that you build on throughout residency. So you move on to VMC clinic. This is Valley Medical Center, our inpatient unit, but we do an outpatient neuro rehab rotation in this clinic. And this is a really good clinic because you get exposure to baclofen pump refills. You get exposure to multiple subspecialty clinics. So like amputee clinic, spina bifida clinic, spasticity clinic. You get to see a lot of the bread and butter of PM&R in the outpatient world. So that's a great rotation. I kind of talked about the VA polytrauma rotation. That's one of our inpatient VA rotations. And the PGY2 is actually paired with the PGY4, and they share a census. So it's nice to kind of work with a senior or a co-resident on that rotation. And then going to Valley Medical Center, TBI. So this is where you're primarily dealing with patients who've had strokes or any type of traumatic brain injury. And we have a journey to recovery program through Valley Medical Center where we can take very low rancho levels. So I think that's good for our training, good for the patients to see how they progress throughout an acute rehab stay. And then VA clinic is an awesome clinic where you get a bunch of MSK exposure again. So a bunch of injections, EMGs, ultrasound, diagnostic ultrasound experience, and procedural ultrasound experience as well. Valley Medical Center SCI, so you're dealing more with the acute SCI patients. So typically you're getting consulted from the main hospital for a new SCI and seeing what a new SCI patient requires in terms of their management and helping with those needs. And then you go to VA SCI where you deal with the more chronic SCI population in the inpatient setting. So I think it's really nice to get exposure to what acute SCI management looks like and what chronic SCI management looks like here. So as a PGY3, you end up doing your second go around of a lot of the rotations you did as a 2, and I think you step up in terms of your autonomy in those rotations. So again, you're doing your second go around of Valley TBI, Valley SCI, VA clinic, and Valley outpatient neuro rehab clinic. The things that you add on as a PGY3, pediatrics, which is very recently revamped here. So we just hired a new pediatric PM&R attending at Stanford who has a specific pain focus. We have a new peds PM&R attending at Valley Medical Center too. So we used to have to go to Oakland to get some more pediatric exposure, and that's quite a hike if you're familiar with the Bay Area. But now we do all of our pediatric training at Stanford and at Valley. So that's really going to revamp the schedule for our current PGY3s. Valley Medical Center consults. So again, that's kind of you being the face of PM&R for Valley Medical Center in terms of receiving consults from the medicine and surgery side, and just seeing the wide breadth of pathology that we get referrals from at this ARU. And then Stanford Sports is an awesome rotation, and it's super unique because you get to work with our Stanford athletes, Division I athletes who are super high level. You get to work in our Arriaga clinics and be their primary point of care. You also see a lot of running medicine and very specific sports related injuries. And you do a bunch of EMGs procedures on that rotation too. And then as a PGY4, it's a little bit more outpatient focused. You do a formal EMG block, and by this point, you're either almost hitting your EMG numbers or you're exceeding them already. So that's a really good block to just kind of tune or fine tune your EMG skills. You do a VA SCI rotation, which is more of an outpatient SCI rotation experience, which adds to the acute SCI management, chronic SCI management, and what does outpatient SCI management look like. You do another rotation in Stanford Spine, and at this point, you're probably growing in your autonomy and doing a lot of these procedures independently, and then having incredible attending oversight to work with you for that, and the fellow as well. And you do another rotation in VA polytrauma. You do 2 consult rotations, one at Stanford and one at VA. And then St. Mary's is a unique private practice rotation that we do. This is in San Francisco, so the commute is a little bit further out, but you get exposure to what private practice PM&R looks like, which is different from academics and community and VA, which is the other exposure settings that we have in our residency. So that's another very well-liked rotation. I'm going to turn it over to Matt. He's going to talk a little bit about our call schedule and other things here.
All righty. So one of the things that is very interesting to our program, and I think is one of the better things about our program, is that we do home calls. So you're at home triaging calls that come in from the hospital. You're either taking care of the Valley Hospital, or you're taking care of VA and Stanford whenever you're on call. So they'll page you, and you'll be able to look at the page, decide what you kind of need to do. So it teaches you a lot about autonomy, teaches you a lot about the medical systems that you have at your disposal. And you can do this from the comfort of your home, which is really nice. You're on call about 1 to 2 weekends per month, 1 to 2 days during the week. And as you move up, so PGY2s have the most call, 3s a lot less, it feels like. As a new 3, I'm digging it. And then as a 4, you're not taking very much call. You're taking a lot of VA call, because the VA call is a little lighter usually than the Valley call. So like I said, there's 2 different call pools. So that's a really important distinction. So next people I want to talk about are the big bosses. Dr. Smook, he's a former chair of IPSIS, the International Spine Society. Dr. Levin, also high up in the spine world, and he's our program director and the spine fellowship director here. And then Dr. Huynh, who's a senior instructor also in the spine world. She's an assistant program director here with us. So the next group is the Stanford attendings. These are a lot of our sports attendings here. Dr. Rowe has been a team physician for Team USA. He also works with the 49ers and the Warriors, doing he does consults for them. A lot of his role is in our orthobiologics, and he's kind of our injection specialist here. Dr. Stanek is a whiz with an ultrasound. He's our performing arts medicine specialist. He works with the SF Philharmonic, and so he can, work with these performing artists, develop adaptive equipment for them. And then he's also amazing, like I said, with injections and ultrasound guidance. Dr. Kraus, she's incredible. She's our sports medicine attending. She does a little bit of running medicine as she took after Dr. Fred, who I'll introduce next. And her clinic is really fun, really interesting, because you see peds, you see kind of that adolescent transition when they're going through a lot of bone stress injuries, a lot of changes in their athletic performance. So it's a really fun, interesting clinic. And then Dr. Fredrickson, he's the sports medicine fellowship director, kind of the boss of the sports medicine world. He's awesome. It's a very fun clinic when you're working with him. That's the Stanford Sports, where you're working with athletes, a lot of running medicine as well. And all these guys are very well accomplished in their fields and have fun, cool research projects and fun, cool interactions that you get to see with them. So it's really a joy to work with this group of attendings. The next are the VA attendings. Dr. Terioka on the left, on the left. So he was our previous program director, and he's still the VA site director. He's just a joy to be around. We do acupuncture and things like that with him. And then he also runs our P-TRIP, our polytrauma transitional program here as well. And then Dr. Oda, he's our SCI fellowship director and our spinal cord injury unit director over at the VA. He's, both of these guys are really incredible mentors and really nice people to work with. Really enjoy working with them. And last but certainly not least, we spent a lot of time with Santa Clara Valley and the attendings there. Dr. Cruz, our chair and head of the SCI division. Dr. Hoy is head of the brain injury division. We work a lot, very tightly with those two. Dr. Varma is fantastic in the brain injury. And then Dr. McKenna is super interesting. So he is neurocritical care. So we have what's called a respiratory rehab unit. So we'll take very sick, very tenuous patients in our RRU, our respiratory rehab unit, and we'll start doing vent weaning here. And that's something that's unique to our program, where we'll wean really high cervical spinal cord injury patients off of a vent. We're talking C1, 2 type of spinal cord injury patients, and be with them, support them, wean them off vents. And you're working with Dr. McKenna every day. You learn a ton about pulmonary mechanics and a ton of how pulmonary care works after an SCI. So it's really a great experience working with all these attendings. Something that I'm personally passionate about is our research. So Chantal and I are big in the research here, and so we love talking about it because there's such cool, interesting projects going on. Some of them you see listed on the left. There's a bunch more that are going on amongst the residents. So the two of us are working on a couple of things that are listed here that I like to talk about. We're starting a project where we're interviewing Paralympic athletes. We're doing biomechanics after orthobiologic injections. We're looking at pickleball injuries. We're looking at lifestyle medicine, healthy aging research. We're looking at EMG types of research. Any type of research that you can think of, you can certainly find it here at Stanford. And we're really proud of what we as residents are doing and what the attendings are doing here as well. And we get to be a major part of it. So we're really lucky in that regard. The next thing I want to talk about is the biodesign. Being that we're in the Bay Area, it's going to be intrinsic to being right next to Silicon Valley, getting some influx from that whole world. And it's something that I'm going to do this upcoming year. It's really a fun opportunity where you get put into a group and you get to try and create a product that fills a need in the world of medicine. And this year it's going to be focused specifically on PM&R. So we're very lucky that we're going to be hopefully designing some new products, new companies that are going to fix some problems within the specialty of PM&R.
You have 4 minutes remaining.
Great. Thank you so much. So we also have 4 weeks of elective time. You can bump that up to 6 weeks depending on your SAE scores. Most of the residents here go above that threshold, so almost everybody gets 6 weeks. And you can spend those 6 weeks doing a whole bunch of different stuff. You can do more procedures. You can do more inpatient. Some of the things here, the Regenex is an orthobiologics clinic, and the Bodor clinic is up in Napa, and you are working with a lot of orthobiologics and regenerative medicine type practitioners. So it's really a fun, diverse breadth of electives that we have here as well. And then the straw that stirs the drink, the funness of the whole program, obviously is the residents. You pick programs a lot. You hear a lot of the, meat of the program, how much you're on call, what the day-to-day looks like. But what makes the program is the people within it. So we're really proud that we have a really fun family here. We do lots of stuff together. So that's Jerry eating a big bite of our Thanksgiving dinner on the left. We play hoops, like we said, every Wednesday. We have parties. We have a lot going on. We see, each other and alumni. So Joseph in the middle at the bottom left picture, is a recent alum. So we all link up at conferences and things like that. It's a really fun time. So just some more pictures here. Big into pickleball and golf. A lot of outdoor activities out here in the Bay Area, whether that's skiing, whether that's playing golf, going to see great restaurants, going out. It's a really fun time. And then, to accomplish your goals, we got to think about after residency. What Dr. Levin likes to say is the perfect graduation class has 50% going right into practice, feeling they're ready to go, and 50% saying that they want to do fellowship. We have had really successful fellowship matches in the past, really something we're proud of. Matching into things like pain, spine medicine here at Stanford, and elsewhere as well, and then sports medicine as well. So something we're really proud of is seeing what our alumni are doing now. And it's really cool to see, and when they come back and tell us all about their stories. So let's talk about the last
We have
class.
2 minutes remaining.
Sounds good. Cyrus is doing pain at UCSD. UA is sticking around here working for us. Derek is sticking around doing a spine fellowship. Savannah's headed back home to New Orleans. And then Steven is doing pain management here in the Bay Area. Misha is doing general rehab out in Santa Cruz. And Roxy's doing pain fellowship at Mayo. So let's talk real quick. We're one of the highest paid residency classes. You can see the total compensation on the right side of that left table. So we offer a competitive salary that was just bumped up thanks to a recent union agreement. So we're really excited about that. Like I said, there's tons to do here in the Bay Area, so you can find your niche here. It's awesome. So there's city life, there's great outdoors, wine, and then you have a family here once you're here to back it all up. So here's some of our contacts. We're going to drop our emails also into the chat. So if you guys have any questions, I know that Jerry and Bonnie have been hammering away at some of them, but we're happy to answer anything else that comes up after this conversation, and love chatting with you, and hope we get to see you here for a rotation or interview, or have you guys working with us in the future.
Thanks so much.
Awesome.
We can answer any questions if we have any more time.
I think you guys are out of time, but thank you all so much for being here. And please drop any contact information that you want to share in our chat. Thank you guys so much.